I'm Dr. Arnie Vineo, and today we'll be talking about asthma, a breathing problem that can become life-threatening in a hurry. Asthma is a chronic respiratory disorder comprised of variable airway inflammation, obstruction, and hyperresponsiveness. Asthma in children differs from adult asthma and has child-specific guidelines. Adult guidelines should not be assumed to be valid for younger age groups. The prevalence of asthma has leveled off in many developed countries, but it still remains a common problem managed in clinics and emergency rooms across the United States. Most asthma sufferers have mild on and off bouts of illness and don't require daily medicines. Minimum doses of any medicine should always be used, and this is especially true for asthma. If, however, you need to take asthma medicines more than a few times each week, that indicates chronic inflammation and requires different medicines that are slower acting than rescue medicines because they work differently. The three major mechanisms involved in asthma are bronchoconstriction, or narrowing of the bronchial tubes, inflammation, and mucus production. Bronchoconstriction is when the breathing passages tighten up in response to an irritant, and the rescue inhalers like albuterol relax that bronchospasm. Some of the bronchospasm medicines are short-acting and some are longer-acting. If someone needs to use these medicines often, they need to be on one of the prevention medicines. Prevention medicines work more on inflammation. When a tube gets puffy, it gets fat on the outside, but it gets skinny on the inside. The combination of bronchospasm and inflammation makes the breathing passages narrow, and it turns someone into a whistle. Wheezing is a high-pitched musical sound best heard with a stethoscope. Most wheezing is heard when breathing out, and asthma is a disease that causes trapping of stale air in the lungs. For anyone with asthma, whether the problem is breathing in or breathing out doesn't really matter to them. Mostly it's the fact that they cannot get enough air. To make matters worse, while we all make mucus in our lungs to trap dust and irritants, with asthma that mucus can get stuck in narrowed airways. Steroids such as prednisone are reserved for the worst cases of asthma, and they can be given as pills and sometimes need to be given as IV medicines in the hospital. Steroids can cause lots of side effects and can raise blood glucose readings in those who have diabetes. Any asthma plan needs to be based on good education, and plans need to be tailored to patients individually. A peak flow meter is an inexpensive tool to have on hand to help decide when to add medicines or when to be seen by a healthcare provider. Non-traditional tobacco use is a very common trigger for asthma attacks in both adults and children, and quitting smoking is one of the very best treatments. Smoking during pregnancy and exposing babies to cigarette smoke may predispose them to asthma. Work with your healthcare provider to come up with an asthma plan that works for you. Remember to call an elder. They've been waiting for your call. I'm Dr. Arnie Vineo, and this is Health Matters.